So, as an architect and creator of geopsychiatry, what sparked your interest in geopolitics and how did that interest evolve over time?
Yeah, that's a very good question. I've always been interested in international affairs from a very young age. I remember being with my dad. I think it was around 1969 when the first man landed on the moon, and we were listening to it on the radio because we're from the Caribbean, from Guyana. So the only thing we can hear was happening in the world was a radio. So we listened to that and many other world events. But we was also fascinated by listening, getting up early in the morning and listening to cricket that comes from across the world. And listening to the commentators painting a picture of the ground, of the people, of the stadiums. It sort of took us there and gave us some vivid imaginations as though we were there. And from that very young age, I began to fall in love with international affairs. And I suspect if I didn't do psychiatry and, nearly 50 years, around the NHS, I might have gone off and do something in the international arena because of that inquisitiveness at a very young age that goes back. That was a time there was no mobile phones, no TV, no technology, no laptops, just a radio. And a radio can spark the mind, as did with me, brothers, and many others who relied on that way of communication. So yes, it created some vivid imaginations, and they're precious memories.
Thank you. So, when did you first begin shaping the concept of geopsychiatry and what key moments or influences guided its development?
I think suffice to say, I've been in psychiatry for a long time. And I think I've got a solid background in that field and in public health. And importantly, I was the sort of deputy head of policy in the UK government during a particular era when they were developing mental health policies, something called Modernising Mental Health Service to National Service Framework. And that really gave me an insight, not only what was happening in the UK, but maybe by meeting colleagues from around the world to understand, what are their challenges and what are they achieving. Just sometimes when you talk to colleagues around the world, you only look for challenges and difficulties, but we also have to listen to them, to what solutions they bring. And obviously having a long career, I've traveled a fair deal, in particularly traveling and helping countries with their educational training. And indeed, in New Zealand, we established the first Careif, the Centre for International Research and Development. And that was at the University of Auckland in response to the numerous amount of people who was leaving Hong Kong and needed resettlement. So we were able to help the New Zealand government and the University of Auckland in developing mental health policies and strategies that will welcome people. And that was a good example of how welcoming migrants can be a humane, task. So yes, so what I did is that I began to understand, the geopsychiatry. I began to plot it maybe around 20 years ago. It's been a long incubation period. And I wrote copious volumes of stuff, of material around conflict and mental health, climate, gender-based violence, human rights violations, austerity and the impact of mental health. All of the significant stresses that exacerbate mental health and mental ill health. And this was a feeling that, was happening across the globe. The financial crisis affected many people. But the major turning point was during the pandemic. The global fear, anxiety that was going, was across the international arena. Health systems were being exposed, some were collapsing. I managed to convince colleagues that we need to acknowledge the world has experienced an unprecedented intersection with mental health, and that we need to do something because we've spoken about it, we've written about it, we've talked about it. We need to consolidate it now. I mean, I spoke at a conference, a keynote at Padova University back around 2010, 2011. And I was fortunate to give that lecture in the room that Galileo used to do his lectures. So there was a poignancy in that. And there the audience really were beginning to grasp how geopolitical events, geopolitical actions are impacting mental health and mental illness. So there was always a willing audience. I spoke about it at the WPA, World Psychiatric Association conference in Cape Town. And the feedback and the comments back were, when are we going to get involved in this? So it's been in the making for a long time. However, you can have lots of ideas and you can write a lot, but you can't do it on your own. I have a very kind and lovely friend, Professor Dinesh Bugra, an icon of psychiatry this century. He began to believe in it, and he became like the delivery access. For want of a better word, the incubation period was long. Along came a midwife that helped deliver this concept of geopsychiatry. Yes. But we begin to do things like webinars and write more and do a lot more work because of the demand that was coming in. We did a presentation for the World Psychiatric Association conference. And the board of the WPA said they would like to establish a group on geopsychiatry and asked me if I would lead that group. I led that group for about 12 months with colleagues from across the world, just to point out that the World Psychiatric Association has 250,000 members across about 130 countries. So it's well represented. That group I led has now become a sort of interest group on its way to become a proper scientific group. So it's a special interest group. And again, we have a membership from across the globe who's particularly dedicated to the advancement and the sensitization of geopsychiatry around the world. So that has been, in short, it encapsulates how we have begun to develop and move geopsychiatry forward. The demand has been there, particularly from low and middle income countries. People say, when can you help us? We are living these geopolitical events, climate change, conflict, human rights violations, austerity, human rights decline in democracy. These factors come together. And it's challenging us in our clinical practice. It's challenging us in our learning and education. So the geopsychiatry is now born, and it's now growing.
Within geopsychiatry, you've introduced two important concepts: the geopolitical determinants of mental health and the CAPE Vulnerability Index, compassion, assertive action, pragmatism, and evidence. Could you explain the idea behind the geopolitical determinants of mental health and why it's significant?
Yeah. You would have guessed by now our drive is to understand and react to mental health being deeply embedded in a web of geopolitical factors. Mental illness, mental health does not stand alone. It's not a silo event. Mental health is across all spectrum of society as we live it. Factors such as conflicts, wars, natural disasters, tsunamis, earthquakes, all have mental health scars, some visible, some invisible. It's not only for mental health that these new determinants are encroaching. These determinants are also affecting physical health. If you look at some of the aspects of globalization and, let's say, commercial determinants of mental health, there are papers published that reported that The cutting down of the Amazon rainforest is possibly a contributory factor to a 10% increase in malaria in that region. So that's an example how geopolitical determinants are affecting physical health as well. The climate crisis and various aspects of physical ill health, respiratory conditions, all the stresses, cardiac ill health, they're all intermeshed and interlinked. So it's not unique to mental health. On the axis of political, commercial, and geographical, culture also play an important part in our mental health. Culture sort of shapes our ideas of health, illness, and death. So therefore, we have to include those cultural determinants, those factors that shape our lives in the way we respond to stresses and ill health. We have a commissioned textbook for a book on geopolitical determinants of mental health over the next 18 months. So more of this work will be crafted from a global reservoir of experts and interested parties from around the world. The textbook will be about 50 chapters. It will be well referenced, well cited, and well documented in terms of what the geopolitical determinants are and how it affects mental health.
You published 2 editions of the Cape Vulnerability Index. How do you envision it being used as a practical tool in foreign aid and global mental health initiatives?
Mental health cannot be treated in isolation from global economic or political issues. Major geopolitical entities like the World Bank, G7, the new BRICS nations, the European Union, WHO, they're all grappling with mental health through policy decisions, i.e. funding allocations, and the bigger aspect of humanitarian efforts. There's a complex interplay between these organizations and geopolitical factors that they influence. The Cape Vulnerability Index helps to identify countries who are most at risk, who are vulnerable, based on 9 determined factors we have calculated on, both social, economic, and health factors. The index examines, such issues as conflict, economic instability, environmental stress, the Gini index, GDP, deaths during conflict, foreign aid, human rights violations. We've published 2 editions of it, so we've used about 26 different indicators to calculate the Cape. And what we find is that we've identified countries most in need of help. They're vulnerable. And our plea really is to put mental health into foreign policy. I'm speaking to you from the United Kingdom, possibly the 2nd or 3rd biggest aid donor in the world. America, Germany, UK, Japan, the 5 largest aid donor. There's a lot of aid money that goes into health across the board and other humanitarian and economic development. Part of the Cape is to influence political decisions, governmental decisions, to prioritize these countries based on these health evidence, health and economic evidence. In 2019, the first edition of the Cape identified Ukraine as a vulnerable country within Europe. It was the only vulnerable country in Europe that was identified as being at risk. The majority of the other countries was possibly in Africa, Asia, Latin America, and the Caribbean. Roll forward years later, we now have a major conflict of war with Ukraine and Russia at the moment. But what we identified was certain factors around, the threat they were beginning to feel, the possible build-up of conflicts, and other Gini and socioeconomical factors. So the index itself actually measures vulnerability of countries. I just want to say something about cost, because the index relates a lot. If you're going to prioritize aid, it relates to cost. The economic burden of mental health problems is staggering. The projection indicates by 2030, this figure could rise to $16.1 trillion. Currently, violence in the world costs the whole world about $19.1 trillion. If we reduce violence by 10%, that can release $1.9 trillion into economic and health growth. That amount of money, $1.9 trillion, is possibly the total GDP of Switzerland or Finland. So there's a lot of money being used for conflict and violence that if we relook at it differently and target and address some of those conflict areas, that's why I said using mental health as a foreign policy tool in foreign aid, I think some progress can be made.
Geopsychiatry is gaining international recognition with 12 centers established globally and the recent founding of the International Institute for Geopsychiatry in Bern, Switzerland. Where do you see the future of global mental health headed, and how do you hope geopsychiatry will shape it?
There's now global acknowledgement of geopsychiatry across the health and mental health arena, both politically, institutionalized, and public interests. We know that from the numerous webinars we have done, various events we've done, and other people within the countries that has done their bit. We've established about 12 centers for geopsychiatry, and they're across the Philippines, Paraguay, India, Pakistan, Brazil, the Caribbean, particularly Barbados, and a new one possibly in Grenada. So they're scattered around the world, and more that will develop. And the purpose of those centers is to work locally within what resources are available to help build the skill base. So rather than geopsychiatry isn't about giving a country or giving a profession or giving a community a framework and says this model works, so therefore it's adaptable to you. No, the model has to come from within. Because there's one fundamental principle of geopsychiatry, and that is health is sovereign. It's a sovereign issue. It's the responsibility of government who decides the health of the population. Doesn't matter how much turmoil they might be in, it's ultimately their responsibility. Just the same, that same government is responsible for the security of those populations. Yes, and the protection of those populations. So I come back to the point, health is sovereign, and we have to treat that sovereignty with the respect it deserves. And the politicians I speak to, and I know it comes back from prime ministers and presidents, they will work with anybody who respects their sovereignty. And that cautiousness, we need to tread with caution within that. So we've had these centers being developed. There's many things happening that will come under the umbrella of the International Institute of Geopsychiatry. It's in Switzerland, a neutral country. Colleagues there has been at the forefront of developing geopsychiatry, so it's just right that they lead it. We've had a 1-week academic seminar where we brought together people from around the world to discuss and how we progress and present their significant issues. There's also developing an Africa-wide program starting in Nigeria. But I think the centers dedicated to working locally and nationally on those distinct challenges. Countries may have specific challenges around what services they have, suicides, training. So we want to work with them on that access. We've produced a number of educational videos, and indeed geopsychiatry is now finding itself in the curriculum being developed for the membership of public health in Pakistan, and I suspect other countries will follow suit. We're just about to publish a paper on geopsychiatry in the educational curriculum, mostly around the medical profession. It is remarkable that that study has showed up how many individuals in low middle income countries who are living in this geopsychiatry time frame, geopolitical time frame, are saying, we are ready, we want what you are describing, geopolitical determinants of mental health, the CAPE index, so that we can add it to our curriculum, because that is what we've been presented with. The center, the International Institute work will focus on research, policy development, and practice, whether it's political practice or clinical practice or public practice. And that is how it works. So there's a whole stream of work we've been doing alongside with the World Psychiatric Association and many other agencies. There's been over 70 publications on geopsychiatry. I mentioned a textbook earlier on geopolitical terms of mental health. There will be another textbook on what is geopsychiatry and how it can work within region. So we're going to split it up by region. And again, there'll be a reservoir of richness of authors that's coming from across the world who have already signed up wanting to do chapters on gender-based violence, human rights, economic, mental health, and a right cross-section. The future of geopsychiatry is multifactorial, but I'm delighted to say we now have an emerging young research academic group who are the future of geopsychiatry. Because I think, you asked me the question, where is it going? We have to have hope. And the hope that young people bring, maybe because they have the energy, they can see the global challenges, they're better educated, they will shape the future, not only for mental health, but also for physical health. Okay? We need to understand that major problems being tackled in the past, like after the war and, regional problems. But we've got to remember that we need to understand how we were able to tackle those problems in the past. In other words, learn from the past so we can understand the future a bit better. We need to understand the world we're living in, how it's changing, so that we can understand what we do for the future. So there is a lot of hope. I am proud to have been able to establish this with colleagues. I'm glad I'm able to narrate this short interview to explain. And I hope it makes some sense. Thank you.
Thank you, Albert.